Hello everyone. In this video I wanted to give you a brief primer on soft tissue instrument tools. We're getting a lot of questions for this at the office, and I thought it would be helpful if we had a little bit of educational material to refer you to. So instrument assisted soft tissue therapy, which is a mouthful, is actually something that's been around for a very long time. We have jade tools that date back 4,000 or 5,000 years that were used in Southeast Asia massage therapy. More recently, fast forward, instrument tools for soft tissue therapy are very popular again, and they are used by a variety of providers in manual medicine. So Steve and I are going to show you a few of the tools that we use here in the office, and there are all sorts of tools. They are named after some more recent physical therapy or physical medicine techniques: graston, factor, and guasha, which is a lot of what we use here. So those tools, modern tools, are made out of stainless steel, and basically a soft tissue tool allows you to do certain things that are difficult to do with your hands, or they amplify what you can do with your hand alone. So I'm going to show you three tools and how I would use them. This is a wide handle guasha blade, and this is something that allows us to have a lot of leverage on really large muscle groups that are a little hard to work with just your thumb. So an example would be the area of the latissimus and the traps, especially on people who work out a lot and are very muscular. And so I can use the tool very precisely to generate a broader area of pressure and do a little deeper therapy on the muscle group. This also is really great on low back muscles. People who have really firm low back muscles that are difficult to release will use often the wide handle tool. Another tool that's used a lot is the simple guasha blade. Steve's instrument here, I believe, is a graston tool, and so they are slightly different iterations of the same handheld tool, and you'll notice that the tools have different areas, they have different length and different angulation, and so depending upon where and how you use the tool, you can work on a broader area. You can work with a little more narrow area if you want to isolate a small muscle group. Even in the hand, when you're working on individual tendons, you can use the tip of it. So it's just an extension of your hand that allows you to do things extremely precisely. The other advantage of these, what we call them blades, is that you can use them at different angle. So this would be very aggressive pressure. If you want to do very light and superficial pressure, you're going to be a little more parallel to the skin and do your glide. The last one, which is one that I really enjoy, is the facial tool. We have a lot of people who develop a lot of tension when they have headaches or TMJ along various parts of the head, and so we can use this tool and do some gentle release of these muscle groups when people get a lot of frontal headaches. And this is a really effective way at working these very, very thin muscles of the face. So bottom line, this is what those soft tissue instrument tools are, and we'd love to answer any questions you have about them.